Well, welcome. Good afternoon, everybody, and thank you so much for joining us today. Delighted to have your company, and I'm sure it must have been a tremendously busy day for everybody. So we really appreciate you joining us today. Delighted to be welcoming our special guest, the brilliant Guy Dudley, for another session, another surgery with Guy on advice for the current times. As everybody will know on the call, a very important document landed in schools last week from the DfE, more guidance and so forth regarding the current situation. So we thought it'd be helpful if Guy spent the weekend, as he did, going through this important document, praising it for us, and he's here to talk through some of those main points on that agenda today. So I hope that will be very helpful. Quite a packed agenda today, actually, to be going through. Delighted to be joined by Guy. Then everybody will know Guy, I'm sure, but for those of you who don't, Guy has been NHT head of advice for many, many years, been on the telephone to school leaders and deputy leaders for many years, so able to hopefully offer, I'm sure, some very insightful and very up-to-date advice as well, actually, which Guy is always known for. So I'm absolutely thrilled that he's going to be joining us. A packed agenda then. You'll recognise some of those headings from the recent document that the new national restrictions that landed in schools, as I said last week. So we're going to have a bit of a chat about each of those different points. And rather than waiting until the very end for your questions, I thought perhaps it might be sensible if, when you have questions relating to the topic that Guy is talking about, please do feel free to pop them into the chat stream or in the Q&A button, and they'll be pumped through to me, and I'll pose them to Guy as we go along, so we can keep the session dynamic and agile and responsive to your questions, and I'm sure there will be many. So it really just remains for me to say welcome to Guy, and I'm absolutely thrilled that he's joining us today. I'm just going to stop sharing my screen, and hopefully you're there, Guy. It's great to see you.
Hi, Andrew. Good to see you again. Good to see you.
Thank you for joining us today, Guy. How's things with you? Busy phone.
The helpline has been ringing off, as you can imagine, combinations of business as usual, and not surprisingly, many questions related to the new national restrictions and how they impact on schools. As people try to get their head around them. So yeah, it's business as usual at the NHT, right up until the next time we can pause for breath at Christmas.
Well, we were really grateful to you for spending so much time going through that new document, the new national restrictions, and putting together a brilliant piece. Actually, you put a few pages together, and that's what we'll be talking about today. And I'm pleased that we're going to be sharing this document, aren't we, Guy, with those, so they don't have to scribble lots of notes. Is that right?
We are. We're making this document. It's only 7 pages long, but we're making it available to everyone in on the call, in on the Zoom session. So by all means, make notes. But if you forget them or you want to refresh your memory, then it will be available afterwards to everybody on this call.
Absolutely brilliant. Well, shall we kick off then, and we'll have a look at the first piece on the agenda, actually. And again, just as a reminder, if anybody has specific questions relating to each topic as you move on and move through each, do feel free to share them. If you could share them with everyone, and then everybody can see your questions, and we'll, if that's okay, or share it privately if you prefer, and I'll pose it to Guy. So clinically vulnerable people is where you'd like to start, isn't it? Very important.
Absolutely. And these 8 miniature topics, Andrew, that we're going to cover are very much the sort of top 8 topics that our members have been calling us about. So they're not my 8 or your 8, they're the eight topics that 44,000 of our members have been calling us about on a regular basis. So clinically vulnerable, no change really. I mean, ultimately those people in that category, or who believe they are in that category, and if any doubt, they should contact their doctor or local sort of health centre. Should continue to carry on going into work, but that's not unconditional. The conditions are that workplace is COVID secure, and the employer has made it very clear to them what those conditions are, so that they are able to comply with them or challenge them if they feel they have a specific need that needs to be met. The interesting one, if we sort of tackle the clinically extremely vulnerable, is that those people are now being advised through the new guidance that came into play a week or so ago to stay at home, to work from home if they can, but not to go into work. And it's really up to them and their employer, their school or their employer, to determine precisely what arrangements those people can make in terms of working from home. That may include, Andrew, a redeployment to a slightly different role. That may include an adjustment to their normal working duties. But the key here is that those people in that particular group must not go into work. And one of the links we've put on there is the current definition. One of the links we've put on that document on page 1, everyone, just in case you won't have seen it yet, but is the link to the definitions of who should be in that clinically extremely vulnerable group. And if anyone is in any doubt, they should see their GP or consultant, hospital consultant. They won't have received shielding letters like they did before. If you remember in lockdown phase 1, many people who were in this group received shielding letters. They will receive a letter. They should have received a letter by now. Not a shielding letter, but a letter that sort of is effectively confirming their CEV status. And the key thing is to communicate with your employer, your school, your authority to determine what working arrangements are going to apply to you working from home for the duration of these new national restrictions, which, as we know, go up to the 2nd of December, but may well then morph into another set of arrangements thereafter.
So what if, sorry, thank you, Guy. We've had a few questions already, actually. And I'd like to sort of, if it's okay with you, even if they're not specifically related to this topic, I might sort of pose these questions as we go, if that's okay. And we've had one from Vivienne. What if a member of staff says that their mental health will suffer if they stay at home?
Well, I think if they're in that group, they're in that clinically vulnerable group, extremely vulnerable group, and they're saying to you, we want to come into work. That's their decision, but it's the employer's duty to ensure that they're well enough and it would be in their interests to come into work. I'm glad you've asked that question, Vivienne, because the answer is on page 2 of the document that is going to reach you, or you'll be able to access afterwards. In the meantime, because obviously there's going to be some dialogue between you and this person, you must say to them, listen, you can't come into work. This is a decision that I need to make with medical evidence, and therefore what I'd like you to do is go to your doctor or go to your hospital consultant and get some certification from them that it is better for you to be in a structured working environment than it would be to be at home. Absolutely. That's in a sense the green. Then if that letter is provided to you or that certificate is provided to you, that's your green light as a head teacher to allow them to come back in to a COVID safe school.
Well, actually, I think we've had, thank you, Guy, and I'm sorry to rush you. It's clear already that the number of questions are coming in that I'm quite keen to cover as many as possible, and I know you'll want to answer them. Joe Butler, thanks, Joe, actually has, I think, a similar situation to the one that you've just described. I have the above situation too, Joe says. My caretaker is insistent that he wants to continue to attend work and is happy with the COVID compliance. He has put it in writing. So I'm inferring from that perhaps the caretaker might be a vulnerable person, but wishes to be at work.
Yeah. So, it's back to, I touched on it in the previous answer.
Yeah.
If, Joe, you've got a caretaker, or anyone of any listeners have got someone who really is keen to work, and I understand that, they want to play their part, and they think their mental health may be compromised if they're to stay at home. This is a decision you can take, but it's got to be supported by medical evidence. It cannot be a self-determined determination. So that caretaker can't say to you, here's a letter from me. There needs to be some medical qualification. And in a sense, that's your insurance against being challenged further down the line, were you to let someone into your school who was in that group, who later had a deteriorating health because they were allowed back into work. The medical practitioner, just to finish on that, Andrew, may actually agree for that person to return to work with some conditions. So part-time working or sort of part home and part work-based. But the important thing is you get that medical certification.
Absolutely. And I think it might, thank you, Guy, it might be a similar answer to Alison's question, which has just come in. Thank you, Alison. What if a staff member thinks that their letter, and I'm assuming Alison here is referring to a letter to tell a person that they're clinically vulnerable. What if they think their letter is an error and they want to work?
Well, I think if they think it's there's an error, I think they just need to go back to the provider of the letter just to make sure that, yes, you've stated I have this condition, but does that really place me in this clinically extremely vulnerable group, and therefore I must stay at home, or is it sufficiently ambiguous that it needs further clarification? So I would simply go back to the provider of that letter just to be absolutely sure that of the group that they're in, and then they can sort of take action thereafter. And in the document, there's the steps that I've actually noted, all the steps you need to take if someone approaches you with a clinical, if they believe they're clinically extremely vulnerable, and the steps that you need to take with that person remotely.
We'll take one more, if that's okay, on this topic before I know we need to move on, but if that's okay. And incidentally, to those on the call who have asked more questions around this specific topic, we have said, haven't we, Guy, that we're going to collate these questions, and we're going to look into ways in which we can supply answers to them.
Absolutely, whether you get it from the generic document or whether I can answer them individually, that'll be absolutely fine.
Thank you, Guy. We're getting a significant number, and I totally understand why. We've had one from Ruth, which is an interesting one, and I think this will relate to a great many people on the call who have already perhaps spent their supply budget, and it's only November, and I've spoken to someone only about this last week. Ruth says, how likely is it that supply insurance will cover clinically extremely vulnerable staff who are unable to go to work? Is that still satisfied by insurance for your supply?
It generally will be. It would depend on, I think what you'd have to do is refer back to your employer or your school business manager, if you have one, to make sure that the terms of the insurance cover do provide for contagious diseases. It should do, in which case, you would be able to get supply in, and that then should be supported by your employer. If not, it may be that the employer needs to go back to the insurer to ensure that it does for future occasions. It may need. So really what I'm saying there, Ruth, is it's determined by the terms of the insurance you have in place. But generally speaking, most insurance issues and policies in this respect do cover diseases such as contagious diseases such as COVID.
Thank you, Guy. If you're happy, should we rattle on to sickness absence? Are you okay to move on to that? We've had a question about pregnancy as well, actually, but we're going to come on to that, aren't we, after sickness absence, if that's okay?
Yeah, absolutely, absolutely. Many of you may have heard of the Burgundy book. Don't switch off. This isn't the dull bit. The Burgundy book is an incredibly useful source of information, and it's basically where the principal terms and conditions of employment are set out. Your HR teams will have a copy of it. The reason I'm telling you this is that in the Burgundy book, the conditions relating to sickness absence are clearly set out. And there's a section in the Burgundy book which actually relates to contagious and infectious diseases. And it's quite important that you perhaps, again, I've quoted the sections in the document. They're quite legalistic. So I've put a plain English explanation behind them, or just underneath them. So you've got the quotes and the passages if you need to go and see your HR provider. But it effectively means that staff with an infectious or a contagious disease, such as COVID, coronavirus, are entitled to full pay, subject to the medical certification. We're back to that importance of getting that medical certification. It also means that it shouldn't impact on the employee's entitlement to sick leave, but it will have an impact on sick pay. So what it's effectively saying is, if your member of staff has a number of days entitlement to sick leave, COVID shouldn't be a trigger for putting that entitlement into practice. However, once they've exhausted their entitlement to occupational sick pay, i.e. what you pay them, if they're off sick, which is on full pay for a defined period of time, depending on their service, the pay provisions will apply. And after they've exhausted their pay provisions that are set out in your pay policy and sickness absence policy, they would then move on to statutory sick pay, which is payable for another 28 weeks. So it doesn't affect your, so three things to note really, Andrew. One is that people should ordinarily be entitled to full pay if they're off with coronavirus. Two, it doesn't impact on their entitlement. So it actually sits aside from their sickness entitlement. And three, it does impact on their sickness pay. So sickness pay is actionable even under an infectious disease. So that would apply just like they were off with a common virus, for example. But have a look at it. It's actually very straightforward. You just need to sort of get those 3 points, and that sick pay absolutely handled, because there's been a lot of questions in HC about how someone's absence that's COVID related impacts on their sick pay entitlement or sickness absence entitlement and their entitlement to sick pay as well.
Thank you, Guy. Sorry, carry on.
I hope that's sort of clear. As I said, it's in the document, so please have a read through that. Naturally, we're having a lot of calls on pregnant women and pregnancies, and understandably, lots of those people who find themselves pregnant are concerned and anxious. Equally anxious are the people who are managing their pregnancy. Because they don't want to do anything wrong. In the document that I'm sending you, and there's different arrangements, unfortunately, for England, Scotland, and Northern Ireland, but I've put the links to those documents in this document for you, so you can just click on those links. Effectively, pregnant women, in short, can continue to go to work. They're actually in the clinically vulnerable group, not the clinically extremely vulnerable group, but pregnant women have been put in the clinically vulnerable group as a precaution and on the advice of the Society of Obstetricians and Gynecologists. There's a really good, couple of good websites. One of obviously is the NHS, and one is actually the Royal College of Obstetricians and Gynecologists, where you'll find there's 4 really good little videos, 2 minutes each, on different aspects of pregnancy-related issues. Pregnancy and coronavirus, antenatal appointments, BAME women, so Black, Asian and minority ethnic women, and pregnancy and the flu vaccine. There's also 50 questions and answers on there as well, which clearly we don't have time to go through today. So by all means, have a click on that. As a school leader or as someone you might be listening on this call who is pregnant, then you might want to click on that link and you'll find everything you need.
Thank you, Guy. That's really helpful and very comprehensive. And before we move on to the next item on the agenda, if you don't mind, Guy, we've had an interesting question from Cindy. Thank you, Cindy, for your question. And it's this: if pregnant teachers are, in Cindy's words here, stretching out their time at work, in inverted commas, by working at home before their maternity leave kicks in, before it starts, can they be asked to start their leave early, if you see what I mean? So it switches into maternity leave because they're working from home?
Yes, they can be asked. There's nothing discriminatory in or risky in asking them, but it is their choice. So I think you'd be into a dialogue with them about why you think it's in the interests of both parties to start the maternity leave sooner rather than later. And you may have very good reasons for doing that. And of course, until you put it to them, they may not think that that's in your mind. So I think the thing to do is open some gentle dialogue with them about reviewing all the sort of arrangements you have at the school, including those arrangements which apply for people who are working from home, who might be pregnant, who might be absent for other reasons. And then that gives you a nice hook into having an open and honest conversation with them, and just make sure it's put in writing and kept on record. But nothing to stop you from making that initial approach.
From raising that, yeah. And from Catherine, thank you, Catherine. What about supporting pregnant women over 28 weeks?
Well, I think, it really depends on the health of the individual. I mean, obviously, you're in the final stages of pregnancy at that stage, and therefore you might be particularly vulnerable. I think the thing to do is, as you may have done for individuals who are in the clinically extremely vulnerable group, although pregnant women are in the clinically vulnerable group, I think I got my teeth in today. I think what you need to do is sit down with them and have a conversation and say, you're clearly in the latter stages of your pregnancy. As long as there's nothing wrong with their performance and you feel that they're okay to go on, I think what you need that's really important is you have that open and honest dialogue with them and say, look, I know you're in the clinically vulnerable group. That's why I'm having this conversation. I'm anxious about that you sort of are able to leave in great health, in really good health, and go and have your child. What I'm looking to do here is, as a duty of care, which you have to all your members of staff and pupils and parents and visitors and so on, you're taking an extra precaution to have those conversations with people who may have be at certain stages of a condition, and therefore, you're effectively doing a risk assessment on them in that final part, because they may be sort of fulfilling a great sense of duty, but at some cost to their own health.
Thank you, Guy. I think the answer may be similar to the next question, which is from Lisa. Thank you, Lisa, who says some midwives are still advising that at 28 weeks they should be at home. If this is different to the guidance, what can be done? Again, it's that dialogue, I suppose, isn't it?
It is, or I think there are certain stages through a pregnancy. And I'm the pregnancy expert at the NAHT. Difficult to understand, I know. It's a long story. But I think, there are certain stages through a woman's pregnancy at which point, you do have to sort of, there's the very early stages. There's a stage at which a woman is given a piece of paper called a MAP-B1, which confirms that all is well, mother and baby are, mother is pregnant. And then there are various stages thereafter through the antenatal classes. I think a little bit like the medical certification on this one, Lisa, I think if your midwife is proposing, because each case of pregnancy is going to be utterly unique. Some women find it a very straightforward process. Some women find it very, very difficult. All women find it anxious. And I think, understandably, and I think, if there is a letter or some sort of certification from the midwife or from the consultant or the GP, that needs to be taken into account. And the employer still has a duty of care. And if the advice is coming back to them that this person is going to be more effective and healthier and hopefully happier and more productive, therefore, at home, I think every provision should be made to enable that person to work from home, despite the fact that they're still in, theoretically, the clinically vulnerable group that is saying, what you're effectively doing is allowing the sort of certification to trump the spirit of the clinically vulnerable definition.
Yes, absolutely. Thank you, Guy. We've had a really interesting question earlier on in the chat, actually, from Natalie. And I hope it's okay with you, Natalie. We're going to cover this. Sorry, Guy, this is relating to a pupil being sent to school who perhaps arguably should not be there through health reasons. We're going to cover this sort of stuff in the coronavirus cases at school, I think, aren't we? Where parents are sending their children in. So, Natalie, I've seen your question. I appreciate your question. I'd like to really answer that one when we come on to that. I just wanted to flag that up because it's a really crucial question for many people. So thank you for that, Natalie. We'll come on to it. Right now, should we move to staff who don't feel safe? Is that okay?
Yeah. I mean, I'm sure lots of you, and we've had lots of calls at NHT, have had calls from staff who don't fall into any category, who are nevertheless very anxious about COVID, about the whole prospect of this public health issue that doesn't appear to be going away, despite some green shoots of recovery with the vaccine news that hit the press yesterday. And you know, we've written, and it's actually in our advice hub, a whole piece on staff who don't feel safe, don't feel well enough, don't feel safe enough, but they don't actually tick any of those sort of clinically vulnerable or clinically extremely vulnerable boxes. And I think, you know, the key to this is dialogue. I think where someone approaches you and says, look, I don't really feel comfortable coming into school. There's nothing wrong with me, but I just feel totally anxious about the whole thing. I think, you know, under a duty of care, you can sit down with them and either talk it through with them and come up with an individual risk assessment that satisfies them that, you know, that the controls that you're putting in place will enable them to come into the workplace and feel safe. It may involve some sort of flexible working whereby they could work some part in the office, in the school rather, or office, and partly at home. You may want to ask them to go to their GP to ask them whether or not they can be certified with conditions that allow them to work under fit notes, as I'm sure you all know now. It's not about whether you're sick or not sick, it's about whether any conditions can be put in place for you. And failing all of that, you could make a referral to occupational health, the occupational health service that your school buys into, or your employer buys into if you don't know that they do. Somehow you've got to get underneath their anxiety for your own sake, for their sake, for the sake of the children and their colleagues, because, you know, I'm sure that lots of people are putting on a brave face at the moment, coming into work, and they're all feeling a little bit anxious. I'm sure they all are, but one or two might just stand out. And I think for those cases, you could ask someone in your school to take the lead on those sort of grey cases, and say, look, we need a system by which we can deal with these people who are coming to us with legitimate concerns and anxieties, but we need to cover those off. Just because they're not in a category doesn't mean to say we don't care about them. You do care about them, you're just caring about them in the slipstream of any sort of categorization. Time consuming, but believe me, the time you'll take getting it right is far less than the time you'll take getting it wrong and then having to clear up afterwards.
So true.
That's your time.
All aspects of headship. Before we move on to risk assessments, Guy, I hope you don't mind, but I'm just going to take a quick question from Alison, which relates back to clinically extremely vulnerable people, because we're probably not going to come back to that. So let's do it now, which is, I think it might be relevant for many people on the call. So Alison, thanks for your question. Alison asks, can schools furlough CEV staff? Under the new guidance, schools are disadvantaged financially for remaining open if we're having to send staff home and then cover their positions with supply staff. So can you furlough clinically extremely vulnerable staff?
No. Is the simple answer. You can't. There may be staff that you may be able to furlough, but you can't furlough that particular group of staff. Now, if, for example, that particular group of staff fall under those that you might be able to furlough, there's the outside possibility that you could, because some jobs are classified as furloughable, if you get what I mean, and some simply aren't. if they're teachers or active members of the teaching community at your school, they wouldn't be able to be furloughed. If they're office-based staff, they may be. So it really depends on the job the person occupies. So that they potentially could be, is an outside chance. I'd check that through with your HR team. But generally, school staff at school, teaching staff, so that's everyone from teaching assistants through to HLTAs, right the way through the ranks to leadership, can't be furloughed.
And thank you. And again, I'm trying to squeeze as many in as I can. Thank you for that, Guy. Just before we definitely move on with risk assessments, and then we'll go to coronavirus cases, and we'll address Natalie's question. Quick one from Joe, actually, that came through on the Q&A. Thank you, Joe. What about those staff who are 70 plus? We have a mealtime supervisor and a welfare who are fit to do their job, but they're over the 70 age. How would we deal with that?
Yeah, well, I mean, the people over 70 are categorized by their age alone in the clinically extremely vulnerable group.
Right.
Someone proposed it was 60 last week, but it's 70. Again, so I think my answer would be the same. As long as they've got medical certification just from their GP, the GP would be fine, and a fit note from the GP would be absolutely fine. And you asking them to get that fit note from their GP is you exercising your duty of care. So if they just pop along to their GP, or they can ring them, and the GP may want to have a sort of face-to-face with them, or a Zoom call at school. As long as the GP is happy to support their continued working, and the school is COVID secure, they may continue. And until they've got, sorry, Andrew, I was going to say, until they can provide you with that medical certificate, you are free to ask them to refrain from coming into work. In fact, you should ask them to refrain from coming into work until you've got that fit note, which is your green light to let them back in.
Yes, spot on. So a related question actually from Claire. Thank you, Claire. So if a staff member has received a letter to shield as clinically extremely vulnerable, but has already had COVID-19, do they still need to shield?
I think it is. I think if the letter post dates the date on which they had coronavirus, yes, I would go with the most up-to-date. I think there are two bits there, Claire. If the letter post dates their episode of coronavirus, I would go with the wording of the word of the letter, which is effectively asking them to shield. The second point, though, is just make sure, and you can ask them to make sure, because you can't on their behalf, that actually the letter still applies. It hasn't just slipped through the system as someone who was shielding, had the coronavirus, has made a full recovery, is very unlikely to get it again, but they've had another letter come out. So I think there might be a sort of crossover there. I might be wrong, of course, but until I think that's proved right, I would stick with the latest information you have. But there's nothing to stop you from going back to that person just to validate it once and for all, just in case it's been an administrative ships in the night passing of administration.
And for those, clinically vulnerable, so not the CEVs, but the clinically vulnerable, such as those with asthma. This is a question from Lucy. Thank you, Lucy. Should all staff who are clinically vulnerable, e.g. asthma, get a fit note? That's a lot of staff. Are they required to have a fit?
No, they're not required to have a fit note. They can get one. There's nothing to stop that person going to the doctor and saying, I've got asthma, I've got asthma. Could you write a fit note to the effect that I should be, managing my condition with a number of conditions applied at work? And then the doctor could write those on the fit note. The doctor is effectively certifying that they are fit to work, but with a few conditions applied in that respect. But no, they're not There's no compulsion on getting one, but they are free to get one to provide their employer, especially if that helps the dialogue along.
Thank you, Guy. This has been brilliant. Shall we allow you to move on to risk assessments now?
Yeah, absolutely. My batteries are still full.
They're great questions, aren't they? They really are. Great.
They are really good questions.
Thank you.
Yeah, I mean, the risk assessments are one of those things that, head teachers hear all the time, and I'm sure you get sick and tired of doing them for all sorts of school trips, sporting occasions. But they've never been more important than doing them now. I mean, we are facing a massive public health crisis, and it's not political. It's a public health crisis. We're not out of the woods yet, although some promising news. Risk assessments should be dynamic by their very nature. You wouldn't go on a long journey without checking the map, checking your coordinates. And I think, the same adage applies to sort of a risk assessment. The new national restrictions that came in a little while ago doesn't mean that you have to redo them. In fact, it just says schools should continue to undertake risk assessments. So you don't need to rewrite them. You don't need to take any advice from anybody, but you do need to just review them in light of the whole school, in light of those people who are clinically extremely vulnerable, and any other risk assessment you feel is necessary. There's not a great deal to say about them other than keep them simple, keep them straightforward, make sure everyone knows about them in right across your staff, but just keep them under review. And of course, if you're a head teacher on the call, you don't have to do this. That's why you've got an SLT. That's why you've got an assistant head or a deputy if you're lucky, school business manager if you're even luckier. These are people that you can lean on and ask to do some of the heavy lifting in this respect. So risk assessments, carry on doing them. Don't reinvent the wheel. You invented the wheel some months ago. Just make sure that they're sort of kept up to date and that there's no complacency creeping into the process.
Thank you, Guy. Shall we move on to coronavirus cases at schools? Is that okay? And then once you finish speaking, I'll mention that question I referred to.
Absolutely. So lots of members of the NHC have been asking us.
Sorry to interrupt. Please do feel free. You must be able to take a drink first if you like, and take a breath. Do you want to drink?
That's all right. Okay. I've got water here.
Okay.
Thank you, Nick. Duty of care.
We are getting our money's worth today, Guy. We really are.
Absolutely. Thank you. Coronavirus cases at school. I mean, lots of members have contacted us and said, look, we've got everything, but what if the worst happens? What if someone really goes down, a child or a member of staff, goes down with all the classic symptoms, a new cough, a high temperature, etc. The key thing is here, you must, if someone does fall ill at your school, you must contact the local health team, whether that be your local authority. By now, you would have all had details of who that is. You'll have a contact number at your local authority. They will guide you through the steps that you need to take. If a child develops, and of course, most of the questions we'll be having is on actual pupils. The question is, do I have to send everyone home that the child has been in close contact with? Well, number one, you probably won't know who the child has been in close contact with all of the time. But the answer is no, you don't. All you have to do is send the person home who is clearly presenting and demonstrating COVID-related symptoms, and you need to contact your local health team. If a child has developed those symptoms and you have sent them home, then the team will guide you through the next steps, but you only send people home when they are presenting with symptoms and under no other circumstances. The other point, of course, is staff, exactly the same. You would send those people home and ask them to self-isolate for 10 days, 2 weeks effectively, 10 working days, 10 school days. And in that time, they would, of course, have a test. And if they tested positive, they wouldn't come back until they'd been cleared by the local health team. And if they showed no symptoms at all, then they would be allowed to back into the school. And you don't need to see any documentation for them to be allowed back in. You just need to make sure that your local health team are kept involved. So in lots of respects, all you're doing is working with your local health team. And I go back to this, it's a national crisis. It's a national public health crisis. That's why these teams have been put in place, to make clear, consistent judgments rather than 20,000 schools making individual decisions and children and everyone else being treated differently. That's why these local health teams have been put in place. Andrew, I was just going to sort of say, if a parent insists, because we've had a few of these questions, if a parent insists their child comes into school, and or you have great suspicion that that child is presenting or is likely to present with COVID-related symptoms, you are free to ask that child not to come into school, effectively excluding them from the school, not implementing an exclusion, but you are free to refuse entry to that child until you are satisfied as a school leader that person is coming into school. Same as a member of staff. I'll just finish on this point. If a member of staff is insisting they come into school, but you're saying no, we believe, we've got strong, firm belief that you have got the beginnings of a COVID related, that member of staff might turn around and say, well, you've got no trust and confidence in me. You're using that as a shield to exclude me from the school. I think as long as your belief is genuine, your belief will be the defense that you need to protect the health and safety of everyone else in that school by denying them access and only allowing them to come back into school when they've provided satisfactory medical certification to do so.
Thank you.
Sounds harsh, but it's it's got to be clear, it's got to be consistent, and it's better that you know these things.
We've had that interesting question from Natalie, which is supremely relevant to what you've just said, but it's an interesting specific case here, so thank you for your question, Natalie. She says, hi, I work in a special school and we have a number of pupils who are clinically extremely vulnerable. What is your advice about parents who want to send their children in who are CEV, as the parents themselves are key workers?
Yeah, I think ultimately the key worker status hasn't had the profile in this second round of new national restrictions as the first time. So I think the fact of the matter is, I think the government have concluded that there are sufficient numbers of key workers now to shift the emphasis of their treatment of the public health condition to the clinically extremely vulnerable and the clinically vulnerable. So in answer to your question, I would say that the status of the child who is clinically extremely vulnerable has to trump any other consideration, because you are the health and safety gatekeeper of your institution, your specialist school, and therefore this time round it has to trump it before the key worker status and those very, very children that were vulnerable because they were attached to a social worker. In a sense, that was their turn. This time it's the CEV people who are going to have to trump everything, including the key worker status.
Yes, I thought you might. say that. So thank you, Guy. And we've had another interesting question from Sarah. Thank you, Sarah. She says, hi, I don't think I've missed guidance. We have pupils aged 8 to 19 with SEN not wearing masks. Are we okay to continue with this as no updates appear in place for special schools?
Yes, I mean, I've, my understanding, Sarah, is that children over 11, so secondary school children, really are asked to wear masks in public places, i.e. when they're moving around the schools, etc. So moving through the corridors and around the school to reach their sort of learning destinations. But as soon as they're in class, they can remove them, etc., as long as they're all sort of facing the right way. And of course, we've had cases of people saying, I'm wearing a mask, even though I'm not compelled to do so. And that's very much a decision for that person, and really down to the head teacher of each institution, because some primary institutions, schools, find the wearing of masks, or the children find them a little bit unsettling. I think back to your question, you've got to go back to your local health team for a sort of full, I've seen and heard, like you, Sarah, I've seen and heard no guidance to that effect. But it literally, and I'm sure everyone on this call will appreciate, the goalposts are moving almost every hour. My phone is pinging with little sort of screenshots of news items. There will be no exams in Wales next year, popped up an hour before we came online. Huge news, and it just sort of pops up out of the blue. So I would say, Sarah, go back to your local health team. But as far as I know, to the minute we started this call, I couldn't see any other guidance in that respect.
Thank you for sharing that number, Alison, actually on the chat thing as well. That's really helpful for all those details. Sorry, Guy. We're time's against us, and I'm conscious we haven't got onto remote working yet. Are you happy to move on to that, or do you want to stay on coronavirus?
Yeah, absolutely. Just a couple of things about remote learning, because it's all relevant. I would say, the single shift here is that the government has used this continuity direction power that effectively says from the 22nd of October until further notice, remote learning must be provided. And of course, that's sort of thrown a cat amongst the pigeons. What I would say that hopefully sort of, slightly takes the cat's teeth out is that the provision of remote learning does not need to be live lesson streaming. It can be anything and everything. So I've put a couple of links on there about the remote education explanatory note from the government, just in case anyone's interested in that. But I've also put a couple more links on there where you can get really good resources. A lot of people have used the BBC, which is a good, credible source of learning. There's others through the BESA, the British Educational Suppliers Association, where you can buy online remote learning toolkits. The final thing I'd just say on that, Andrew, is that it'd be really good for anyone who's leading on remote learning to just keep the plan, what was in the mind when the school set this out, just as they would, a self-evaluation plan or a business plan for the school. Keep a plan of the remote learning because Ofsted, when they do start their inspections again, are going to want to see it. It doesn't have to be long, it doesn't have to be elegant or too sophisticated, but just keep a plan of it. And all that advice is in this document that is available at the end of this webinar, or as soon as we can get the recording out to people as well.
Thank you, Guy. Sorry, carry on, please do.
I was just going to make a final point. We've had lots of questions about after-school clubs, preschool clubs, wraparound care, all of those sort of things that aren't taking place during directed time. Can all of those things carry on? The short answer is yes, they can. They can all carry on, preschool, lunch clubs, after school, as long as, of course, all the COVID-19 measures are in place for those as well. They don't relax just because the school bell has gone. They stay in place until the school gate is locked at the end of the day. But just to clarify, all of that can still go ahead.
Thank you, Guy. And we've had so many questions, and I'm so grateful to you for answering all of them, or as many as I can put to you. We've had a number that we haven't been able to, but actually others on the call have managed to answer questions for others, which I think is absolutely terrific. Right. And is exactly what school leaders do, isn't it? It's so brilliant. But I am going to end with one question, which I think will not exactly bring a smile to fellow head teachers on the call, but they will nod their heads, I suspect, which is, and it goes like this. Can you give any advice on how to deal with a situation where a parent is openly stating on social media that they do not believe COVID exists and are not following guidelines or restrictions? And this has caused concerns with other parents who are now keeping their children out of school. I bet that's happened in a number of schools, isn't it? What do we say to those people?
Well, I think
it's a word for them, but we
I'm sorry to whoever's in this position, and there may be more than one of you. I think, like everything, you've got to treat this seriously. I would start by inviting the parent in to the school. I would not meet them alone. I would very much meet them with your chair of governors or your vice chair. Don't meet them alone. They're clearly not quite wired into the situation. I think for your own safety, I think it would be good for you to meet them, invite them in. If they refuse to come in, I think you need to write to them and ask to meet them, because ultimately this is undermining the whole confidence of parents. It's probably impacting on the reputation of the school. Yeah. The school has the parent has a duty to send their child to school by law. And it may be that you have to escalate this to the local authority, who are the admissions authority. And I think really when you peel away the layers of this sort of conversation, we're back into admissions. We're back into saying that your employer has a legal duty to provide a place of learning for your child. You as a parent are contracted legally to make sure your child goes to the school, and you are contracted legally as a head teacher or a teacher to provide that education. So I think you go back to that whole profound relationship. I think first of all, I would invite them in with the chair. They may need a voice. They may want a voice. They're using social media as a platform. That's not healthy. That's not good. Nobody would advocate that.
Elaine has asked a question. Sorry to interrupt, but it's so relevant. Thanks, Elaine has just said, should the school report this behaviour if they're seeing it on social media?
They could do, although lots of social media providers will always argue that these are platforms for free speech. I think unless this person is breaking the law in terms of effectively peddling illegal publications, I think they're entitled to use it for the fact is they're not using it rationally or sensibly or helpfully. So I think really you need to make sure that you have opened dialogue with them. You've made every attempt to reach them with your chair of governors. If not, I would get your local authority to intervene. Just on that final point, Helena, if you feel that the parent really is overstepping the mark, I think that's probably a case for your legal team at your local authority to write to them. But the chances are a stiff letter from the legal team in your local authority may just dissuade them from using social media, because the chances are they're going to drift into water that they cannot tolerate or defend. So I think I'd follow that position. And there's lots of legal remedies that the school could take, especially communication injunctions, for example. But they would need to be taken down the legal route after you've tried that sort of duty of care route.
So thank you, Guy. can I squeeze one more question out of you? We really have grilled you, and it's a testament to you and to your professional advice that so many people are still on the call with us, and we're nearly reaching the hour. But it is a question that I can see would be troubling. So thank you, Lynn. Do CEV pupils need a fit note to attend school? A fit to attend school note? CEV pupils.
Yes, yes, they do, especially if they're insisting coming in. So, CEV pupils, must have, and we've got to just unpack that expression. It's clinically extremely vulnerable. So they've been put into a clinical category, and the only people that can do that are medical professionals. No one in the teaching profession can categorize someone. It's a medical determination. It's a medical judgment. So yes, the answer to your question is, Lynn, yes, they do need to provide a certificate to say that they are medically fit to come into school. Doctors will find that very routine business, and you shouldn't have any pushback whatsoever.
Thank you, Guy, and thank you to everybody on the call for sharing your questions, for sharing your suggestions and answers to each other's questions. It's been terrific. I couldn't agree with you more, Claire. Thank you for thanking us and for saying it really helps to know that we're not alone. You absolutely are not alone, and what an amazing job everybody's doing. It's hard to say anything like that without sounding patronising, isn't it, Guy? And we don't mean to. I just think everybody's champions on this call. And thank you, Guy, for your insight.
No, my pleasure, and good luck, everyone. Hope you can manage to get to Christmas. And just to really let you know, the NHT really is fighting your corner, and we're fighting for all the funding that we can get at the moment to make sure that schools are able to function effectively and safely. But your safety is our absolute number one priority. But hope you've enjoyed the session, and thanks for having me again.
Thank you, Guy, as always.
Thanks,
Absolutely.
Andrew.
Thank you so much. Thank you, Guy. For those on the call, I'm just going to share details of the next similar session with Guy, exactly the same session with Guy again. I'm looking forward to it, which we're going to hold. I'm just going to share the screen with you, and then I'll come off. So we're actually going to be holding another session. Forgive me. I'll just... so there we are. Just going to share it. So we're holding another session on the 30th of November at 4 o'clock. A further discussion with Guy on the issues facing you on the call. So I do hope you can join us then. Please do. I think it's been a really useful session for everybody. I've thoroughly enjoyed it and found it very interesting. I was a primary head teacher up until just over a year ago when I joined Discovery Education, and I certainly would have found it very, very reassuring to know that we're not alone. Many people on the call will probably be attending, hopefully, the NHT Early Years and Primary Conference this Thursday, a couple of days' time. And I just wanted to share that I'm delighted that a number of other pathway authors will be joining us for workshops. David Gumbrell's doing a brilliant course called The Head's Control Tower, Resilience. He's a very well published author and former primary school leader, expert in resilience and the effects of resilience on our ability to teach. So do check that out if you can. And Hannah Tudor, the brilliant Hannah Tudor, great primary school leader, head teacher, working at a school in Kent. She is actually delivering a workshop on building professional arrogance in our teachers. And knowing Hannah as I do, I know she doesn't mean arrogance in the way you might think, but really giving them their confidence to be able to strut and to really feel that sense of empowerment and agency. And I'm going to be doing a workshop, an entirely COVID-free workshop on planning for creativity. I thought let's indulge ourselves and celebrate the children's creativity and look at ways in which we can plan for creativity in the classroom. So I hope you're able to attend any of those workshops. I really look forward to attending that conference with the NHT. I know from past experience how brilliant the NHT's conferences are. So I hope you're able to join us then. But thank you ever so much for joining us today and for staying on for such a long time. Thanks for staying with us. If you'd like to find out any more about the Pathway Programme, as I've often mentioned on these webinars, we are fortunate enough to have been working with Guy in the Advice Hub part of the Pathway. And of course, Advice Hub is only one part, a very important part, but it's only one part of the Pathway Programme, which is very much to do with your personal development and your professional development too. So check it out on the website there if you wish, or join some conversations on the hashtag The Whole Teacher. I hope this has been useful for you. And I don't know about you, I'm going for a cup of tea. Thanks very much. Bye-bye.